Good afternoon, Mr. Chairman and members. My name is Maria Hummer, and I'm the Communication Director for the Texas Catholic Conference, which is a statewide association of the Roman Catholic Dioceses of Texas. We want to thank you for the opportunity to share our concerns regarding House Bill 636. Catholic teaching insists that health care is a basic right flowing from the sanctity of human life and the dignity of the human person. Adequate and affordable health care must be accessible for all because health care is a basic human right. Genuine health care reform must protect human life and dignity, especially for the most voiceless and vulnerable, and health care legislation must respect the consciences of providers and taxpayers and not violate them. Cardinal DiNardo, the Archbishop of the Archdiocese of Galveston-Houston, has urged Congress nationally to support a reformed health care system that respects the life, health, and conscience of all. We make the same request to you before the committee today. We want to thank you and support the abortion provisions in House Bill 636, which prohibit health plans in the connector from providing coverage for an abortion, as abortion is not an element of health care, but in fact a procedure that destroys the life of the human child. We are, however, concerned with the following elements of the bill, and I believe you have written testimony before you. So a lot of these have been talked about, so I'll just briefly address them. Specifically, adverse selection. We have to make sure that there's a level playing field inside and outside. We need to ensure that the governing board does represent the interests of small business and individual purchasers. We want to make sure that this connector is transparent, that it's coordinated with Medicaid and CHIP, and that we establish a no wrong door system so that families can seamlessly transition between CHIP, Medicaid, and the exchange. We also want to ensure that there's a diverse array of navigators to help, like you've heard. And finally, we want to make sure that there's value for businesses and families, and that means that the connector has to be able to leverage market power, just like larger employees do, to get good deals for those that are in the program. We want to thank you again for your efforts to ensure access to quality, affordable health care for all, because health care is a basic human right, and we want to make sure that this becomes a reality in Texas. So thank you again for the opportunity to testify, and I'll take any questions if you have any.
Any questions? You mentioned something about the abortion language. Is that in the bill right now?
That is in the bill.
Okay.
I haven't looked at the community substitute. I'm not sure that has changed since then.
All right.
Thank you.
Thank you very much.